So finally, we are on today's last panel of the day, ESG and climatized supply chain. I would like to call upon stage Mr. Rajiv Tiku, the host of Sustainability Karma podcast. So please come on the dais. Mr. Anil Johri, the ex-CEO of National Accreditation Board of Certification Bodies. Dr. Raj Shankar Ghosh, the Senior Advisor at PHFI. Mr. Mukesh Sinha, Director OACL Devices Limited. Mr. Ritik Mahajan, Business and ESG Supply Chain Consultant. Mr. Samant Murthy, Partner ESG Compliance and Consulting, SRS Consulting. I would request Mr. Rajiv sir to please start the panel.
Hello, thank you very much, and thank you PhD and Maniji for this opportunity. Thank you, my for taking time to be here. It's really kind of them. The session is on ESG and climatized supply chains, which is the last session of the day, and I think we don't have too much of time and we don't want to hold back people also. At the same time, we're keen to talk about issues also. A couple of days there was a headline in the newspapers which was issued by CMD of Nestle, and what he said is that crisis is a new normal. Whether he was talking about himself because he's an outgoing person or his company or the industry, but all of us are in the same boat actually. We're also facing this similar kind of situation. And VUCA conference is very timely, and VUCA itself seems to be getting a VUCA taste, because I was doing a bit of Googling and I realized there is another term which is competing with it. It's called BANI, brittle, anxious, non-linear, incomprehensible. So coming back to this, the times are very uncertain. And in this context, ESG and climatized supply chain is a very important topic, and at the same time a challenging topic also. We'll hear from the experts how they're walking the talk on this difficult challenge actually. And particularly when we also know that there's an anti-ESG movement in the US, ESG related funding is plateauing, it's not really going up. And banks are pulling out of what we call net zero alliance. And then, of course, Indo-American professor Ashwath Damodaran Saab has been contributing to this anti-ESG movement quite a bit. So in this context, walking the talk is a double challenge actually. So we'll hear from the experts how they're doing it and what they have to say for the future. So I'll begin with my all fellow panelists. I'll request them to talk a couple of lines about themselves and also their perspective overview on ESG supply chains, climatized supply chains. Then we'll get to specific questions very quickly because we have very short on time. So I think for I'll begin with Johri sir. Johri sir, who is a veteran in this sector. So sir, please, a few lines about yourself and then the overview on the subject.
Yeah, good evening everybody, and thanks Manish and PhD CCI for inviting me on a topic on which I am not an expert. Neither a healthcare expert nor a climate change expert. So. But okay, from my experience, I mean, I've been, like has been said, I've been CEO of NABCB. My expertise is accreditation actually, which takes me to various sectors because needed everywhere. So I'm in CDM and Article 6.4 accreditation panel, to Ayush, to yoga, to medical devices. That's what brings me here. I mean, as far as ESG compliance is concerned, or I broadly say sustainability rather than ESG compliance, only ESG reporting. I mean, it's something that we have to be ready for. It's a demand of the time. Typically, we have been slow on regulations, unfortunately, as a country. Two parts to that. One, I think 1991, the liberalization created an environment where it became fashionable to say we are over-regulated. It is still fashionable to say we are over-regulated. Fact is, we discovered, some of us discovered earlier, but surely we discovered during COVID that we were actually under-regulated. Every single product that you heard about, whether it was PPEs, whether it was masks, whether it was oximeters, whether it was ventilators, all of it was unregulated at that point of time with no assurance of quality at all. Fortunately, we had just issued a regulation and we were on the way to regulation. Fortunately, today we are regulated. But somewhere in 2017, I was part of a governmental meeting where it was stressed that we are at 15% of EU's regulations. Textile was unregulated, medical device was unregulated, chemicals was unregulated, telecom was unregulated, toys were unregulated, machinery safety even today is unregulated. So there were a whole lot of sectors that were unregulated. So that is one problem that we face, that we are not regulated enough. On the product side in healthcare we are, on the services side we still are not. In the morning I was discussing with Mr. Harinder Singh whether medical value travel facilitators should be regulated, and he was in favor of regulation. But where to, then I quickly messaged DGHS whether medical value travel facilitators will cover under Clinical Establishment Act, and immediately got an answer, no. So the first problem that arises when you start to regulate is under which act there is a provision to regulate. So, well, there seems to be no act right now. But there is one act which has not been used for regulation of this kind, which is being overused today for regulation of products, and that is the BIS Act. We hear about QCOs at one place, second place, third place, whole lot of controversy about QCOs. But the fact is that act allows you to regulate products, processes, services, etc. And we have never touched process and services there. So that is one part of the issue that we are facing. The second part is the voluntary standards, and sometimes I am concerned about this mix-up that we do between regulations and standards. Now actually standards means, in terms of WTO language, it's been technically defined as voluntary standards. So when you say standards, you should mean voluntary standards. And when you are talking regulations or compulsory, what were called mandatory standards when I joined BIS way back in 1980, you should talk regulations. You simply say regulations. And this is a distinction we need to make clear, because a lot of our problems are also because of this mix-up. So to begin with, I'll start with this as a setting up scene, and then we'll come to more.
Thank you, Dr. Johari, for making those distinctions which lots of us are confused about, not very clear, ambiguous about. Thanks a lot for making those distinctions. I'll come to Dr. Raj Shankar Ghosh, who is from PHFI Center for Environmental Health. Sir, a few lines about your work and quick overview on the climatized supply chains.
Thank you. So first of all, good evening everyone, and I wanted to thank the organizers for inviting me to this conversation. So I am a physician trained in public health. I've been practicing public health for the last 35 years, primarily focusing on health systems and primary health care delivery. At this point of time, after my completion of a regular job, I've set up a startup at IIT Delhi with a few professors there called the QVI Initiative, focusing on the quality, equity and inclusiveness of healthcare services. I also consult with a couple of organizations, including the Public Health Foundation of India, where I oversee the environmental health work. What I wanted to speak about very briefly is that in terms of environment, the first E, it does not happen in silo. The whole structure of the environmental work is actually based on 4 pillars. With the agencies that we work, primarily the private sector healthcare, the 4 E's that we work on. The first is about efficiency. We cannot talk about the environmental goals to be reached without focusing on the institutions efficiently delivering the healthcare services. The second is about the equity part of it, that whatever we talk about in terms of environmental health, we need to understand that there is a vulnerable population that is being affected by the environment and the climate changes, and therefore the service of the healthcare that we design will have to provide equitable healthcare services. The third E is about the environmental norms that we must maintain, the environmental standards that we need to follow, and finally, it is all about the ethics part of it, that there are various ethical considerations that need to be taken into account when we design our ESG principles for the service that we would like to deliver in our healthcare services. I'll stop here and we can speak.
Thank you, Dr. Ghosh. It is interesting to hear about quality, equity, inclusivity, and also environment in the same breath. Thanks a lot. I'm sure it's going to bring lots of value to it. And we'll come back to later to Dr. Ghosh, because PHFI has set up a platform for ESG for healthcare sector, which not many of us know actually. We'll come back to that later. So I'll come to Mr. Mukesh Sinha. Sir, a few lines about yourself and also about your overview on the topic.
Okay. So once again, very good evening to all of you. My name is Mukesh Sinha. I'm a director, listed company called OSL Devices Limited. I have another company working, we are working on the AI side. Within AI, it is a conversational AI side. And I have organic company also. So this is the brief about my current working. As for the topic is concerned is, every day we are seeing we are feeling and not seeing, in fact, we are feeling every day that kind of climate changes are happening and other things. So ESG is no more just textbook. We every day across the globe, the things are happening. And we need to take it more conscious decision. There are regulation, as for India is concerned, still it is in quite early stage. We are filling the data, but we are not that way acting as for the need to be done in the things there. So that's the context, I would say, the current situation. But of course, now we have signed the agreement and other things. So going forward, it is going to be concern for anyone and everyone.
Thank you, Mr. Sinha, for sharing those observations. Very interesting. We'll come back to that later. I'll come to Mr. Ritvik Mahajan, who has come all the way from Jammu to talk about his briefly work and also the context of the topic.
Yes. So very good evening, everybody. I want to thank the honorable panelists and for the organizing team for having me here. I am a management consultant. I work with the pharma companies optimizing their supply chain. So my consulting company, we primarily work with the pharma companies of the like of Sun Pharma, Dr. Reddy's, Zydus Cadila. We manage their warehouses and high-speed inventories. We design and develop algorithms to reduce down their expiration cost and hence increase the profitability of an organization. Apart from this, I also work with the leading hospitals of India to make their purchase decisions. So we'll be primarily talking about how we have worked out using technology, artificial intelligence and machine learning. We have designed certain algorithms that has reduced the redundant work that was initially done manually, and we have switched to smarter platforms developed on SAP, which is helping us to achieve a sustainable supply chain.
Thank you, Mr. Mahajan. Mr. Mahajan is essentially an engineer who is also a management graduate. So that's very interesting kind of a mix in pharma. So I think we need more of such people here. And I'll come to Shamant Murthy, who's come all the way from Bangalore early in the morning, started at 3 and had a long day. So Shamant, a few lines about yourself and the context of the topic.
Sure, sir. Again, thank you everyone for having me here. Such an honor to share a seat with all of these dignitaries. To begin with my introduction, I am into providing consulting support for both businesses as well as investors when it comes to tracking and improving ESG metrics. While for businesses, this may mean not only looking within their own organization, but also across their supply chain. Again, it would be a meaningful part of their supply chain, because I would not claim to help any company track their entire supply chain. And on the other hand, for investors, this would again mean developing frameworks and tools to help them measure the entire ESG impact of their investments across their portfolio of companies. Now, to share my perspective of ESG and climatized supply chains, specifically supply chain becomes all the more important here because it is a critical nexus where any company's sustainability ambitions meets its operational reality. And the key challenge is to maintain a healthy balance between the two. And I, being a tech enthusiast, again believe that technology is a very strong enabler in this regard. Thank you.
Thank you, Shamath. I mean, it's very interesting to hear that health is not only health, it's health plus lots of things combined here. So I'll come back to Dr. Johri here. Sir, how can Indian regulators use FTAs or global forums like WTO to ensure that Indian exporters aren't unfairly penalized? So that's one thing. And secondly, is there some way of harmonizing carbon accounting, probably to our advantage also, where we can really preempt CBAM type measures?
Well, a very tricky question actually. See, the first thing I would say is, are we prepared for FTAs? I mean, before we go into leveraging FTAs to our advantage, are we prepared for FTAs? When it comes to regulations, we face two scenarios. A, there are regulations abroad and there are none here. We have faced this situation. CBAM is there is nothing equivalent here. And B, there are regulations there are regulations here. Now, if we have a regulation, for example, let's say medical device, the MDR. Is MDR compatible with global regulations? My answer would be no, it is not, because it references BIS standards as the first choice. I wish it was international standards as the first choice. Then we would be able to say that our devices meet international standards, and where there are no international standards, we go for our standards. But right now it's the reverse. So even proving equivalence of the regulation to international regulation is a problem. Where there is no regulation, for example, CBAM, there is a regulation there and we have no regulation here, even more difficult. What it requires then is, let us assume, and I think it's a fair assumption, that most of our regulations are not globally compatible. Whether it's medical devices, whether it's food, whether it's whoever, whatever is there. So therefore, and in second situation where there are no regulations here, so there's nothing here. In either case, what we need to do is to build an alternate system where we can certify the industry to those global standards which are acceptable. For example, I know for sure that we have the tools available and the expertise available to create a system of verifying emission statements which are being submitted to EU today. Now, if we were to create such a system and go to EU and say, you accept our system rather than imposing your, we will produce an equivalent system and you can do this. That will ease our problem. That would certainly bring down the costs, if nothing else. You get, even before you submit your statement, it's already verified, you're through with it. You don't face all the challenges that you'll face after you submit to EU and you get all the queries back from there. But unfortunately, the problem is that the understanding of these issues in government is poor, in industry is poor, and therefore nothing happens. So this is the challenge we are facing. So, I mean, I do not, as far as the BIS Act is concerned, I mean, of course, fortunately medical devices are regulated under Drugs and Cosmetics Act under not BIS. But where the BIS and medical devices are getting affected by some of the QCOs which are affecting the components. The model of using a national standards body for regulation itself is globally incompatible. You do not find this model in any of the developed economies for a simple reason that standards bodies there are actually private sector, they are industry driven. So they cannot be leading the regulation. In India it's a governmental body. So we have a host of problems. So when you say, can we leverage FTAs to our advantage, my answer would be, at this point of time, we are not even prepared to for FTAs because we do not have a system in place which we can present as globally equivalent or either regulation or or a voluntary kind of system.
Sir, why do we begin and how do we break this vicious cycle? You have worked at the highest level across sectors.
Very difficult to make government understand, honestly. I mean, in last 2 weeks, I have written to 2 regulators, met one, written to another, and I'll give the examples. We are developing a carbon trading scheme right now. And there is advertisement out for accredited verifiers, empanelment of accredited verifiers by Bureau of Energy Efficiency. And I'm asking a question, why are you accepting all kinds of accreditations from around the world when the world does not accept our accreditation? Why should you not insist on NABCB accreditation of verifiers to begin with, and then use this as a leverage when you talk to others, that, oh, all right, we are willing to accept your accreditation if you are willing to accept our accreditation in reverse. Same thing, I went and met Chairman APIDA. APIDA has issued a circular to all its certification bodies, organic certification bodies, please bring in ISO 17065 accreditation. And I went to him and I told him, why are you accepting all kinds of accreditations coming from outside India, and why not Indian accreditation, and then leverage it. To give you an example, I have been part of some of the negotiations. One of them is India-US, where we are under tremendous pressure right now. And US has been pressurizing us for the last so many years. I participated was 2015. They are pressurizing us to accept test reports in relation to electronics and IT products. That why do we accept our reports, and regulation demands test reports. Regulation only demands test reports. So I was asked to talk to USTR in one of the this thing. I said, fine, let's agree on a principle. What is the principle on which we will accept your test reports? There has to be some principle. And once we have agreed on the principle, let's agree on the sectors where we will accept test reports. He immediately jumped, no, we are talking only of electronics and IT sector. I said, but how is that? We have no interest in electronics and IT sector. We have an interest in agri, we have an interest in pharma. So let's agree on a principle and accept test report. He backed away and the matter stayed there. Matter still stays there. So the point is, if we have to, we need, everyone needs to realize that we need levers to, to be able to negotiate. I mean, way back 2007, I still remember, I made a presentation to Commerce Secretary in 2007. G.K. Pillai was Commerce Secretary. And I told him, you are in no negotiating position. He said, why? I said, two reasons. A, half the places we do not have regulations, so what will you negotiate? The other person is having no problem accessing your market. You have all the problem accessing his market. He is not interested in a dialogue. Second, where we have regulation, your regulations are substandard. These are developed economies where we have a problem. They have standards, they are using international standards in their regulation. They have no problem still accessing your market, but you have a problem. So how do you negotiate when you can't create a problem? So that is where we are. So I am very skeptical about whether FTAs will bring us much relief, not on tariffs as we see. I am not an expert on tariffs, but what I am reading. But on my area, which is technical regulations, non-tariff measures, as of now, I do not see we are really equipped to leverage FTAs to our advantage.
I hope you're able to influence the government and people who matter.
Chairman APIDA did say, he told his team, please change the rule and say NABCB accreditation.
Thanks a lot. I'll come to Dr. Raj Shankar Ghosh. Sir, we keep on hearing from time to time that private sector is adopting ESG measures, but what is your experience and a bit about your platform also, and how can government sector, public health sector really take to ESG adoption?
Right. Thank you. So I'll be very brief given the time constraint and this hour. We at Public Health Foundation of India manage a platform which is called the Health Platform, Healthy Environment Leadership Platform. It is a platform for private sector hospitals to connect to each other, and we'll talk about whatever I speak, I'll speak in the context of the health network. And I'll just highlight 3 points. The first is that we strongly believe that the future of healthcare, both in the private sector and the public sector, will be driven by 3 T's. The first T is about technology. So therefore, we look at how technology can be applied in order to ensure that we are becoming environment compliant. The second T is about teamwork. So we identify who are the complementary partners, including the community, who we can join hands with. And the third T is about trust. That trust needs to be built across all the stakeholders that we work with and we cater to. The second is that we have a framework, and the framework is called the I framework, across which we work on environmental sustainability. The first I is about the integration of environmental activities within the larger framework, the one that I talked about, efficiency, equity, the economics part of it, and the environment. The second thing, the second I is about the innovations that we can bring in order to drive the ESG platform. within the hospitals. The third I is about looking at all the investments that we need to make, and the investments are not the rupees or the dollars, but the investment is the capacity building of the various workers, the health workers, the various kind of hospital service providers whose capacity needs to be built, in which we need to invest. And the fourth I is about the institutionalization of this within the existing system. And the last thing that I want to say is, for us, sustainability is something which is in continuum. It is about RST, the alphabets. R comes from the responsibility factor, which is again mandated by various regulatory kind of compulsions that are there, but also there are various kinds of for-profit organizations who are becoming quite responsible towards their output in terms of the environmental issues. The second, obviously, is the sustainability framework that we discussed. And the third T is about the trust, how all this work can build trust within the patients, within the communities in which the service is delivered.
One supplementary question quickly, but how can public health sector learn from the experiences you have?
Oh, the partnership that we have with the National Center for Disease Control, we are applying the same kind of principles, the framework that we talked about, the I framework, about measuring the impact of it, about understanding how it can be integrated within the National Health Mission, about how the investment can be made in the healthcare workers, building their capacity, and finally at the state level, how this can be institutionalized within centers of excellence in each state. Each state has a different center of excellence, and we identify those centers and institutionalize this. So this is a learning from the private sector that we are adopting at the National Center for Disease Control.
Thanks a lot. Maniji, probably something which can be taken to the larger audiences because they may have missed out on this point actually. Thanks a lot. Welcome to Mr. Mukesh Sinha. Sinha Sahab, you are running so many companies. Now, how can the policies at the board level be helpful in promoting ESG? Can we link up, for example, incentives with emission reduction targets? It's happening in some companies worldwide, but in India also, can we do something similar or maybe some other alternatives?
India just started, as far the compliance is concerned, top 1,000 listed companies, in terms of value-wise, they have to present their ESG report apart from the financial report. So it is just started, and of course there are some good companies, they have started this position dedicated like manager sustainability or fancy kind of designations are there. But practical point of view, still I would say walk the talk is always not the same. And there is a great example, and it's a published data, just example L&T. It's one of the India or probably now leading global companies, the building companies, infrastructure companies. But if you go the data and other things, most of the work is outsourced. So there, because the biggest as per ESG is concerned, one is about the labor related issues or in environment. When you talk about the building, it's the environment. They have given the contract to the third party, and third party is again been outsourced. So it's not end-to-end map that has to be done there. So government is okay, they started the process, okay, you submit the report, but going forward, because when we talk about the compliance, source has to be matched. All the vendor has to map from where the source are coming, whether they are also ESG compliance or not. So that is the biggest thing, but good thing is started already. Second, about incentives, so like carbon market and other things, when you are particularly on the export market, you have to, Europe is particularly quite concerned about that. If you are not ESG compliance, you are not able to do the business in coming few years. In fact, they have already started offloading the vendors if you have not started the process. So wake-up point for India 2030 is one of the biggest challenges. So most of the company, particularly who are on the export business, they have to have, and process is started. Skill and other things, I believe in India, that is one of the concern. I think Government of India, MCA are trying to promote the sustainability courses, all the leading centers. So process has been started, sir.
Yeah, thanks a lot. But my experience with some of the industry's top industrialists, I'm talking about the legacy businesses, they're still struggling with scope 3. And some of the new age businesses, they do it in silos actually. Scope 3 is something which everybody is completely in dark. So apart from the regulators and the global pressure, can there be also some bottom-up pressure from SMEs particularly that they need to be integrated into the system before they really hit hard?
So, like particularly you talk about SME, so recently, not recently, it's already for a few years, so one of the scheme or certification called JED. JED stand for Zero Effect, and we talk about Zero Effect, it is effect on environment, and Zero Defect. So if you, and it is like a bronze certificate and gold standard, they are the, I think parameters are quite good. And particularly for MSME and other things they have started. In fact, we are also JED certified company. So that is the first, I would say, very credible. Sometimes there are another NABH and other things, particularly hospital construction and other thing is concerned. Green building and other thing, all these things are linked to that. And governments are also giving some incentive to that.
Thanks a lot for making those points. Ritik Mahajan, you have been working on pharma supply chains particularly. Yes. And I also understand that a case study has been published by Ahmedabad also. So could you give us a quick context about that and also talk about how is the supply chains really reacting to trade fragmentation in this globalized world and how is it playing out on the ESG aspect actually?
Yes. So honestly, COVID was the time that gave a nudge to the Indian public to start the trade fragmentation and start rethinking the supply chain strategies wherein we started manufacturing in India. And Honorable Prime Minister Shri Narendra Modi supported the initiative by Make in India movement, wherein India would have never dreamed of manufacturing the medical devices, API drugs, and all the technological innovations in India. So that was the time when the trade tariff for imports were increased and people were forced to make in India. And now the demand versus the supply was a big gap, and there was a surplus production on the manufacturing side, and people didn't know how to analyze the demands. So we stepped into the picture. We started designing smart software solutions that used to analyze the data from the GST portal, from the HSN codes to that level of derivations. We were trying to analyze the demands in a particular region, and that data was shared with the pharmaceutical and medical devices industries to regulate their manufacturing. Eventually, this dependency on technology actually gave them more accurate data. Initially, there was a big loss to the pharma industries of the expiration cost of the drugs. So the drugs which get expired on the shelf, so there was no real-time analysis of data through the software, through our algorithms. So these pharma companies were real-time tracking the shelf replenishment of the pharmaceutical drugs, and they were producing accordingly. So we designed a system in which a leading player of the pharma industry has eliminated all the levels of manual intervention for designing an order. Initially, it was a more than 20-man job in which a person used to analyze that how much sale has been done in a month, and then a medical representative used to come. He used to see whether my target has been matched or not. If not, he used to place a surplus order to the company, and that was where the dumping was done. So using the smart technological system, these dumpings were monitored and were reported to the companies. So let us suppose a pharmaceutical salt like a PPI, which was not being consumed in the month of January in Jammu Kashmir, was moved to Punjab, understanding the demand. So that really helped to regulate the inventories, and the expiration cost was reduced, eventually reducing the carbon footprint. And I belong to the industry which contribute almost 60% of the global carbon footprints, which is the supply chain industry. So most of the manufacturing, when it started in India, so the shipping cost was also brought down. That gave an opportunity for more employment, more job creation across the region.
Can you have a similar kind of intervention where, for example, Can we have a similar type of intervention where probably a SAP type of platform can help us enforce sustainability at every standoff where, it can just flag, okay, there's a violation, there's no reporting or there's no accreditation.
Exactly.
Is it possible?
Yes. So that is what the Mankind, one of the sponsors present for the event today, and Sun Pharma did. So they are using the SAP platform to build smart systems to analyze the market demands, seasonal demands, and manufacture accordingly. So that has really helped them to again alter the cost and reduce their supply chain expenses and losses as well.
Right. Thanks, Ritvik. I'll come to Shamant quickly. Shamant, you have been using technology quite a bit now. Do you see bigger role for emerging technologies like AI or blockchain or IoT in improving supply chain transparency and emission reduction?
Yeah, I mean, there have been very well-established use cases, and there are promising applications out of these technologies, be it AI or blockchain. Again, there have been marketing people who have loosely thrown out these terms around, but they have very serious use cases. Just to quote a couple of them, the company UPS has recently come up with the Orion system, which is helping them map and optimize their on-road fleet for over 55,000 of their vehicles. And on an annual basis, it is helping them save over 10 million gallons of fuel. And similarly for blockchain, there are a few promising applications. For example, as Anil Johri sir was mentioning, we have a classical use case of inventorization of emissions for monitoring carbon credits and their transactions, for which blockchain is seriously being considered. However, having said this, I still do not call either AI or blockchain as a silver bullet for such use cases, especially when a supply chain is being involved. Because you will have to see further nuances on its on-ground implementation. Just as Ritvik was mentioning, integration with existing SAP systems, that might be a fantastic use case for the first or second tier of suppliers. But down the supply chain, as and when you move into the informal sector, this becomes a huge hassle. And again, considering blockchain as a technology, the inherent transaction costs and latencies that are involved, they make blockchain prohibitively very expensive for mainstream adoption, especially for larger scale operations. Now, having mentioned these limitations, we also prescribe a couple of approaches that companies could explore when it comes to adoption of these technologies, so that they can make a meaningful use out of them, despite having these drawbacks. So first, rather than jumping headfirst into a technology such as blockchain, companies any day have an option to consider transitionary technologies. For example, they have an option to explore quantum ledgering, such as Amazon's QLDB. So just to very briefly touch upon this, QLDB, what it does is it offers the same immutability and transparency across the supply chain transactions, while also being very economical and being more suitable for larger scale applications. And the second approach would be to adopt a phase-wise strategy when it comes to implementation. So for example, if any company can say that I can identify top 10% of my suppliers who contribute to about 40% or 50% of the transaction value across the supply chain. So that would be a fantastic point for them to start, because these are the top suppliers who have very well established digital assets. So integrations and implementation would be hassle-free relatively. And the level of impact that these players have on the supply chain is also very considerable. So covering them would also cover a significant portion of the ESG metrics across your supply chain. So this is how we help companies at least begin adopting these technologies to exponentially improve their tracking and improvement of their ESG metrics.
If I may come in here briefly, you talked about the ESG part of it. If I come from that angle, there are so many reporting requirements, different formats, different standards, and different regulations,
Right.
and it's very difficult for companies to do that. Now, are there third-party options available where you can have data points and probably pull in the data for whichever report it is, GRI है या आपका European है या Indian है, for example, BSRR है.
Yeah.
So is there that kind of a thing? I know, for example, Renew is a big company.
Yeah.
It has created a metadata matrix where they can pull any data from anywhere and put it together.
Yes.
That's very
Yes.
optimization.
Yes.
But what is available for mid-level, small-level companies?
Yes.
They can't be spending their life and time on only reporting actually.
Yeah. Again, that is a severe challenge that especially the MSME is being plagued with. So we did try our hand at implementing generative AI for this particular use case, but the challenge itself is extracting and interfacing automated data exchanges so on ground. So again, that is a manual process that still happens. So there is a significant lag between whenever a client company asks for its supplier to give their ESG reporting metrics versus when they actually get it. Because again, in Europe, there is a clear-cut case of CSRD, wherein companies beyond a certain threshold of revenue, they are being asked to track the ESG performances of their entire supply chains. The challenge that the companies are facing is they are unable to consolidate these data points and prepare meaningful reports within the reporting timeline itself. So that is one hassle that is still plaguing this particular sector.
Thanks, Dr. Shaman. I think we are short of time, so I quickly have one quick round of 1 minute each for everybody. If we could have one recommendation based on this today's conversation and for this section which could be fed into the reporting.
I would say enhancing understanding of industry and policymakers on issues involved is the biggest for me challenge, because most people do not understand the issues that are actually involved in terms of regulation as well as standards.
Yeah. So India, I think, did it as for CSR is concerned to make it legal, right? So CSR little bit part of the ESG. Similar things can be implemented to the regulation also, and should be given the opportunity for timeline. Okay, you find out because there is no historical data, so you need to start from somewhere voluntarily and then go to the compliance point of view. So that could be the one of the things I would recommend.
Thanks, Dr. Ghosh.
So my only kind of recommendation would be around the building of competent workforce in order to drive India's sustainability, governance and accountability agenda forward.
So my take would be educating and implementing technological systems to reduce the redundant supply chain in order to reduce the cost as well as improve the efficiency of the system.
One strong policy prescription that I would like to share is again a call for standardization of different ESG scores and disclosures. Again, it should be machine readable as well as auditable, so that any chances of greenwashing or politicization of ESG as a core concept could be avoided altogether. Thank you.
Thanks a lot, Shaman. I think those are very interesting points. Those are very interesting points and takeaways from this session, and I hope we can close on that note and thank the organizers again for giving us an opportunity to be here. Thanks, Dr.
Thank you all the esteemed panelists for your insights today. So I would like to call Mr. First we'll take a picture, then we'll do the felicitation. For the picture, I would also like to call Mr. Jatin Nagpal. Sir, please be on the dais. I would like to call upon stage Girish Joshi sir and Jatin Nagpal sir for felicitating our esteemed panelists for this session. Mr. Rajiv Tiku. Mr. Anil Johri. Dr. Raj Shankar Ghosh. Mr. Mukesh Sinha. Mr. Ritik Mahajan. Last but not the least, Mr. Samant Murthy.